So my first question is, you started to look at digital health and well-being from the standpoint of Generation Z, and you said in your keynote that you're going to the Houses of Commons in a couple of weeks' time. Could you describe a little bit more of what you hope to get out of taking the people to Houses of Commons and taking it forward with your work?
I mean, I guess a big part of it is, I remember being a PhD student, and one of my professors told me that the average academic article was read by 6 people.
Yeah.
And now that sort of academic articles are doubling every 10 years, like millions and millions of them, probably less than that now.
Yeah.
Most are probably not read at all. So I think part of it is wanting to make sure that what we do has a bit of an impact beyond academia and some meaning in people's lives.
Yeah, I think just beginning that debate as well at a policy level. So I think, schools are far more aware of issues around internet safety, but I think that aspect of digital health hasn't yet, really been addressed within schools. And I think, we need to have that discussion at a policy level in terms of what resources young people need, and the people who are responsible for young people, so teachers, parents, and thinking through some of those bigger questions as well about companies and the role of big data in schools. And that kind of, so there's wider developments.
And privacy and privacy issues,
and I think the question came up today around regulation and what that might look like, whether that's healthcare or within school context. And I think moving beyond the fear of addressing those things as well.
Yeah, and we've got a few young people coming to the event, and I think one of the things we're very conscious of is that policies are often decided by people that have nothing to do with the worlds in which these policies are applied. And where that comes to sort of young people and the use of mobile health, this is something that is not just sort of irresponsible, but actually quite dangerous potentially. If you don't really understand how young people operate within digital space, then any kind of policy develops likely to be completely ineffective. And I think we see that historically, even over the last 10 years, with how digital health has developed. And it's such a fast changing world that involving young people kind of all the time in these steps is just crucial.
And I think taking that critical stance as well, this notion that the sort of techno-optimism, that the digital health is the answer to a lot of the problems and crises within healthcare, and the assumption that young people are this homogenised group. So I think that those questions around inequalities and risks as well is something that we hope to explore at that event as well.
So you've just mentioned regulations and risk, and you've done some previous work regarding ethics. Could you describe your thoughts of how ethics may impact negatively and positively in the area of digital health and well-being?
Well, certainly in terms of just the recent weeks with the Cambridge Analytica scandal around Facebook, sort of pulls into question both our awareness of what's done with our data, but our capacity also to limit the use of it. And so there, from a kind of clear ethical perspective, your capacity to be autonomous, to be self-directing with your life is majorly affected by the policies that these social media companies have. And it's no sort of surprise that people don't read the detail of their terms and conditions with the social media applications. And so we need to kind of really rethink how people are engaged with some of these matters in their use of the platforms themselves.
Yeah, so we've talked directly to young people about things like third-party data sharing, privacy, and I guess what they tell us is they're aware of things like dangers of who they talk to online and so on, but those issues of where their data goes and what choice they have over that is fairly limited, I would say, at this stage. And I think there's also, in terms of regulation and ethics, the question of choice and agency and consent to what's done to young people, as subjects of surveillance or data that's collected on them, whether that's for reasons of healthcare. So, examples of big data companies going into schools to collect data about their fitness and their health. What happens to that? So, there are examples where young people choose to use these technologies, but there's also examples where they're pushed towards them and monitored So, and placed under scrutiny and surveillance. So I think there's some real interesting ethical questions around that as well.
And perhaps also some exceptional questions around ethics within this framework. I mean, lots of people would think that we just have to apply present ethical principles to this world and everything will be okay. But we sort of think there are completely novel situations that people find themselves in as a result of much of their lives being located within digital space. One of the things we talked about today was blockchain, and how as an ideology, the idea that people are not just participants in the development of their data, but co-owners of the register of the data around their health is incredibly appealing and incredibly different from the present social media system where everything is owned by a system, an individual or a company. And that sort of value system we think is likely to bubble up quite quickly amongst young people, where they want to have ownership of the data, but also some way of verifying how it's used, rather than it being this kind of nebulous world in which they've no idea where it goes.
And my final question, if you had one wish, what would you like to see happen in the future of digital health and well-being?
Gosh.
One wish. I mean, I guess for me, the key thing is around ownership around our data. And being able to move it from place to place in a way that is, it allows us to sort of maximise its value. At the moment, I think we're incredibly limited in what we can do with our own data, and we don't really have a kind of right to our own data in the way that I think we need to both protect against some of these sort of concerns about how data is used, but also just, I mean, particularly to keep innovating. Because the challenge is that if I use a particular platform that's owned by a company, it's very difficult to then share that with, I don't know, the NHS as well, when in fact I would really rather support the NHS with that data and the insights that might come out of it. And we're still quite limited in what we can do with it, I think.
I think that would be my
copycat.
priority area. I guess the other thing I think is the sort of stakeholder conversations, and I think a lot of that happens in isolation. So, you know, and there's some really innovative examples of ways to address that. I don't think it's a big wish, but I think, you know, just as a starting point, maybe. So things like living labs, where, you know, seeing increasingly young people, you know, communities, designers, academics, really coming together and starting to think through what might the future look like. And I think, you know, part of what we've done a lot of is critique and, you know, highlight some of the implications of the technologies on people's identities and health practices. But I think there is real scope to shape the future of digital health, but that requires, I think, different platforms and ways of engaging those conversations that I don't think we're quite there yet.
Also, if I didn't have to update my phone ever again, that'd be pretty good too.
Well, thank you very much for this conversation today, and thank you again for being our first keynote presentation.
Thank you.
Thank you.